There's no easy way to do that other than talk to them, be honest with them, but you have to be a good communicator. The second thing I would tell you is you have to learn to delegate tasks to your staff. You can't do everything because a dental practice is very complicated. There's lots of moving parts, and you have to be willing, you have to be sort of the captain of the ship, delegating who does what to allow you to focus just on quality patient care. And thirdly, I would say is you have to really work on decision making. Be decisive, especially when you come to treatment plans for patients. They want to see a decisive nature in your voice. It gives them confidence in what you're proposing.
Well, I really appreciate that. And when you're talking about working with the dental team as well, I'll go over to you, Dr. Patel, for this one. So the dentist is the leader of the clinical team. We know that, but they don't necessarily have the practice or the confidence yet to manage and interact with their assistant or their hygienist or the front office staff. How would you propose a new dentist approaches working with their team, and what kind of skills should they have?
A lot of this definitely goes back to those soft skills that Dr. Bell mentioned, but the biggest thing is very concise communication and building a team and a schedule around that. I think one of the most effective things I've found in running two very busy practices when we have 20 team members, and then each associate is seeing about 20 patients a day. It's very quick. We make sure that we have a very effective morning huddle. And that really gets your entire team on page, from your front office to your assistants, hygienist, all your associates, and you really can map your day. And that really will help you bring that really clear, concise communication and forward that over to your entire team in the very beginning of the day. So those 15 minutes right before you start your day are so effective, and that translates over to the rest of your day. So I would definitely start with that. And we do a morning huddle, a midday huddle. And this way, if there's any hiccups throughout the day, we can go ahead and figure it out there right then and there, so that we don't have to have that dribble over to the rest of our day as well. And then having effective team meetings, so everybody knows, hey, these are our expectations. This as a new doctor, these are my expectations for my schedule, my patients. This is how I run, and that's really going to give you great leverage. And building your footing in that office is really participating in that team meeting and having an extremely effective team meeting.
Mm-hmm. Well, and kind of leveraging from there, Dr. Vanni, when you think about a new dentist patient schedule in a clinical environment versus a dental school environment, it's very, very different. And navigating that change can be stressful. Do you have tips or techniques that you can talk to the students about how to make that change effectively?
I'll certainly do my best. So I think building on both Dr. Bell and Dr. Patel, when it comes to communicating with patients and communicating with your team, being able to speak with confidence, right, with decisiveness, to Dr. Bell's point, being concise, right, with both groups, whether it's your team member or your patients, and helping them understand why it is you're asking them to do what you need them to do, whether it's your team supporting you or for your patient, right? You're trying to help them understand why it is that you're recommending this treatment plan. As a new doctor, that can feel like a lot when you're just trying to think, did I cut a good crown prep, right? Did I clean out all the decay? Am I too close to the pulp? And so I think really knowing yourself, knowing when to ask for help from a doctor mentor, knowing when to, end a case at a certain point. Maybe you were planning to do 3 fillings and you're only able to accomplish 2, right? But setting steps for yourself to be able to do good, confident work as you build that speed and efficiency, as you build that comfort with communication, and be comfortable taking small steps rather than expecting that it will just all come at once. Because there really is no shortcut. And I'm sure Dr. Patel and Dr. Bell can think back to when they were first working, right? But for me, there's no shortcut to gaining that experience. And so being patient with yourself and having great case selection initially will help set yourself up for success and continued growth.
Can you elaborate a little bit about case selection, what you mean by that?
Oh, sure. So for me as a new general dentist, I learned over the years that I actually loved working with kids. At UIC, while I loved my time at UIC, I did not get to do that much active treatment with pediatric patients. And so for me, I wasn't ready to take on the most advanced pediatric cases yet because I hadn't built up those skills and efficiencies, behavior management techniques, that take time to build. And so for my first pulpotomy and stainless steel crown, I selected a patient who was, 7 years old and was not anxious, right? That was a good case for me to start with for that procedure. Now I can, do that procedure on a child who's nervous and less cooperative. Initially, though, you need to set yourself up to be successful and know, again, when to ask for help, when to seek a specialist consultation or refer out. And again, just be open with your dentist peers. Hopefully, you have a good mentor to talk through those nuances. Because again, you want to portray confidence to your patient. You also need to ask for help from other doctors when you're first getting going. And I think there's no shame in that at all. It should be encouraged and celebrated when we reach to one another for help.
I'd
So you
like to
don't
add
have
to
to feel
that.
like you're just, oh, I'm sorry. Go ahead.
Always ask for help. I'm 70 years old. I've had a lot of people that helped me and mentored me along the way, and I have the opportunity to do the same thing for people in return. You will not always be able to do everything yourself. You're going to come across a situation that you're not going to be sure what to do, or you're going to do something that doesn't turn out well. Don't be hesitant to reach out to ask for help. People and your colleagues are more than willing to try and help you. They want to see you be successful, so never hesitate asking for help.
Yeah, no man is an island. You
Right.
can't do it by yourself. So that's great advice. One thing that we're talking about the importance of establishing positive relationships with your patients, getting them to say yes to the treatment plans that they need. How do you go about establishing that trust with a patient that you don't know? Anyone who wants to take the lead.
I'll start.
Okay.
First of all, be honest with your patients. Never try and blow smoke at them. Be honest. Tell them, give them your honest assessment of what's going on and what you think would be the best treatment plan for them. Let them know that you care about them. You want to do what's in their best interest. Answer their questions. Always answer their questions. And if they still don't understand, simplify it a little bit. The more you simplify it, sometimes the better it is. And lastly, don't get in a hurry. Take time because they'll sense it if you're in a hurry too. So,
Absolutely. And one of the big things that both doctors had touched upon is being concise as well. So especially coming out, you're going to have some cases that are just very complex and you can really get lost in that. So trying to build trust from the very beginning will also help you navigate through a very complex treatment plan. So being effective in the way you describe procedures, a root canal, an extraction in a way that is comforting for the patients, that'll help them understand what they need. As far as the complexities, and you will have these cases that are not just a few fillings, even as much as you try to choose certain types of patients, they might have a multi-specialty treatment plan. So navigating something like that and getting your patients to accept a large treatment plan is difficult. So getting a great mentor to help you go through these complex treatment plans is okay. I just remember the first month and having several complex treatment plans, and it didn't even know where to start. And sometimes we get very lost in it. And it's just a phone call away to ask somebody, let's review these x-rays together. And this way you give your patient the best opportunity to help themselves and you feel more confident in navigating through a complex plan.
Mm-hmm. And this is a question I'm going to pose to all of you. You're working as a dental team. You have an assistant. Sometimes you have a hygienist, and you're working in a environment where the patient's right there too. And you certainly want to be on friendly terms with your dental team, but you're the leader. And I wonder, are there pitfalls is there a line between being friendly with your team and being friends with your team? And what would you advise?
Well,
Dr.
I'll take this
Yeah.
one because I've seen this play out in a lot of different ways. I was a managing partner of the largest group oral surgery practice in Dallas for 35 years, so I've seen it all. You want to be first of all, you want to be a leader in your practice. You want your employees and your patients to see you as the face and the leader of their practice, so they'll look up to you for things like that. Always try and encourage them. You can be friendly and you can also be friends, but there's a line between the two. Always remember your purpose in practice. You're there to provide the highest quality care that you can. And if you are friendly with them and you want personal conversations, don't do that around your patients. Always do that, the break or in the break room. Keep the personal issues totally separate from patients. And just got to remember, they're your employees. You're there to deliver dental care, and keep that in mind, because if not, I've seen situations get out of hand before, and when they get out of hand, they're really bad. So
I definitely
I've been there.
I want to add nowadays with social media as well.
Yeah.
I've just noticed we've had many scenarios in the past that I've seen where there's too much going on social media. So making sure to limit that, or if you're not, and if you're friends with your team on social media, to make sure to keep it professional.
Yes.
So what you're posting out there, definitely want to keep it professional. And especially coming out, you're young, and a lot of your team members are also young. And so all of a sudden you're connecting on other levels other than your workplace, and that can get very blurry. So forming team bonding activities where everyone is included, that's a great way to navigate. Like, hey, we can all hang out, we can all be friendly and talk about other things, but maybe outside of the workplace. And that can help us navigate through that friendly and professionalism that we're looking for.
And these skills, they, again, when you're communicating with patients, you want to be consistent in how you approach treatment planning. With your team, you want to be very consistent in how you're approaching them, treating them, building relationships with them. Because one of the most devastating things that can happen in a practice is when there is perceived favoritism, and it can just rip teams apart. And again, this is something, I think, Dr. Patel, you said it well, this often happens inadvertently, right? We're trying to connect with people. We're trying to have good relationships at work. If we're not very cautious about, maintaining that professionalism and remembering that we as the dentist at the end of the day are the person who's responsible for what's happening within that practice, things can get messy. And then, Dr. Bell will just add you to his list of stories that he's seen. And no one wants that for anyone who's participating here tonight.
Yeah.
Well, and I guess the other piece of it, and it isn't limited to a dental practice, is if that line is crossed and you become too friendly with your staff, they may not have the respect for you and your leadership. And that's okay if things are going well, but in difficult times, maybe not so much. So I'd imagine that would be somewhat of a caution. So I've been checking the Q&A, and y'all are being a little bit shy. So I'm hoping that some of what we've talked about may have sparked some questions. So feel free to type them in and we'll get to them. As I said at the beginning, we're more interested in what you're concerned about and want to help ease your way. So I'm waiting for the little Q&A light to light up.
We can ask each other questions all night if we need to. I would love to hear questions from the students.
Well,
you had a question there about the 5 C's.
Yes.
Critical thinking and communication. I had a couple of comments on each of those right here.
Okay.
With critical thinking, again, I'm just repeating myself. Always do what's best for your patient. There's so many different ways, and in oral surgery and in general dentistry and all of dentistry, there's a lot of different ways to treat problems. And you need to give patients alternatives and do what's really best for them. From a communication standpoint, you have to be relatable to them. They don't necessarily want to see you as a friend, although you can be friendly with them, but they're there to seek your opinion and your professional treatment. Otherwise, they probably wouldn't be there. Collaboration, work with your staff and other healthcare providers for the overall best treatment plan you can come up. I know in oral surgery, and I know for general dentistry too, there's sometimes you have to consult with other healthcare providers if there are medical issues or certain types of things that you'd want to deal with. Creativity. Use some imagination on treatment plans. Sometimes thinking out of the box helps you a lot. I know I spent 10 years as a board examiner in oral surgery, and I heard treatment plans that I would have never thought of before, but actually they would probably work well. So be open to things and be creative with your treatment plans. Character. Allow the patients and develop the trust in your patients so that they have confidence in you going forward.
I have a question too. Okay. A question from the audience. What are the most important things we should be looking for or asking while meeting with DSOs? So would this be in terms of interviewing or what the practice environment might be like?
Most of what I do is recruiting oral surgery residents for practices that we have somebody retiring. And so I'm dealing with residents, but I think the same thing applies to dental students. Talk to them about their clinical responsibilities. They all want to know what type of compensation they'll get, but you need to, most of them, I have children that are this age too. They're looking for work-life balance. What can you do to provide them a work environment where they're doing dentistry and probably not a lot of other administrative tasks to allow them to practice dentistry the way they want to, hopefully with minimal clinical interference, to allow them to really practice high quality dentistry. Those are the main things I would ask. You'll certainly want to know a lot of things administratively about how the practice works too.
And welcome back, Dr. Patel. We missed you.
Yes, thank you. And also for the students who are on this call, we are going to be talking about how to ace your interview when we're at the National Leadership Conference, excuse me, next week. So we'll go into some depth, but I'd also like to ask the panelists, looking back, what is something you wish you had known that would make you feel better, soothe your anxiety, whatever it might be when you first started?
Sure. So, in answering the question too about what should we ask when interviewing with or considering joining a DSO, I think that was kind of the gist of the question that the student asked, is really any practice that you're getting to know and considering joining. I would highly recommend that you treat each opportunity as its own unique opportunity, because each DSO is different. Each private practice is different. As I heard once from a colleague, there's nothing more private than private practice, which is true, right? Every private practice operates a little bit differently. And so I would go into all of your interviews asking very similar questions, which is really what is driving this practice day in and day out? What is the organization's values? I had one job early on where it was clearly all about money. I went and found a different job because that didn't sit well with me. And guess what? That job, they were actually even more worried about money. So, and I obviously wasn't asking the right questions. Chatting with the team about what they like, right? Dental assistants, hygienists, other doctors, what do they like about it? What has kept them there? Obviously, like Dr. Bell said, compensation, benefits packages, those are all important questions for any job, but really understanding what it's like day in and day out at that office within that organization, the more questions you can ask to get at that, right? So will I have mentorship? Will someone be reviewing treatment plans with me? What if I have a treatment plan that someone else disagrees with, right? What happens then? What happens if a patient gets upset, right? Think about some scenarios where things aren't going right, and how does the practice deal with that? Because that's, I think, where a lot of the interest comes into play. When things are going well, probably every dental office is almost the same because patients are happy, the team is happy. When stuff gets dramatic, that's when you see the differences play out.
If you join
Well,
a
I'm going to
practice,
give
it
a
has to be
plug
a
to the
good cultural fit.
dsodifference.org website too. There are a lot of interview tips. So it's dsodifference.org. There's a lot of good information on there, but yeah, some things that you should be thinking about when you interview in whatever environment. I'm sorry, Dr. Bell, I
Oh, no, that's it. It has to be a good cultural fit with you and the staff in that office. And,
Mhm.
you know, it doesn't take long to figure that out. If it's not, it's going to be a miserable work existence for you. So you need to determine that early on. If it looks like it's not a good cultural fit, it's probably not a good place for you to go.
Would you
And
recommend kind of working interviews to see if it is going to be a good cultural fit?
That's a great idea. We used to do that in our practice too.
Mhm.
You can also ask to shadow in advance as well, since you are in school. So we get a lot of students come into shadow, and it's wonderful. They get to kind of really get in there and start looking through patient cases and really working through what a day would look like in a practice.
Mhm.
And that's a great way to get your footing into what kind of practice I would like to be in. There's a lot of dentists that are super open to having you come to the practice and shadow, and great to do before you have your license. And one other thing I recommend a lot to students that ask me, what should I be asking, or what's appealing to you as the interviewer? And one of the things that you can work on, and I think someone had asked this, is really work on a portfolio. I really feel like I'm hiring an artist when I'm interviewing, and I have no idea what kind of work they have. I'm really just going off of what they're telling me. And of course, you'll provide the best work, but it's really nice to see some of the things you're so proud of that you've developed during school. And those are some of my favorite interviews, is when I get to talk about cases and they bring cases to me. And my second suggestion is go early to your interview and sit in the lobby. Sit in the lobby 30 minutes early. See how the front office says hi to you and how they interact with each other and how they interact with the patients. And you can get a really nice idea of what the culture might be in that office. And just let them know I'm super early and it's totally okay. I'm going to be sitting over here, and whenever doctor's available, I'm ready for them. And go super early. And this way you have some time to really scope out the practice.
Well, I love that. And we've been getting some questions in the Q&A. And so I'm just going to pose them in the order that they were received. The first one, there was a dentist who wants to retire and is asking me to take over directly out of school. The practice is very small. How do I politely refuse while maintaining a good relationship?
Oh, well, in my experience, it's best to be direct, right? So if your gut is telling you this isn't the right opportunity for me right out of school for whatever reason, I would just share that and say, I'm honored, right? This is really great that you thought of me. This doesn't feel like it's the right fit. And, I appreciate you thinking of me. I wish you well. I would just keep it short and sweet and be honest.
Yep.
Agreed.
All right, so here's a fun one. Something which we could all learn from. What are some red flags to look for when interviewing for positions?
And I think I would go back to that, is that sometimes you can just see those red flags the moment you're sitting in that lobby and seeing how everyone's interacting with each other, how the doctor might come up, how a lot of things happen in that front lobby. So great first spot to figure out those red flags. And I think Dr. Bell mentioned it, but just straight asking, what is your clinical culture at this practice? And if they're ready with an answer, or they're still fumbling on that answer, how passionate they are about that culture or not, because that is so important in figuring out which practice is going to be the perfect fit for you.
Ask about mentoring capabilities too, because if the doctors that are there that you're joining, if they're just busy running from room to room and really don't have much time to spend with you, they're probably not going to be able to spend a lot of time mentoring. So you want someone that will talk to you and visit with you and be honest up front about what the capabilities in that practice are going to be to help mentor you. And because you really just don't want to be stuck on your own from day one.
Mhm.
It doesn't work in general dentistry. It certainly doesn't work in oral surgery either.
And I think, to Dr. Patel's point, observing while you're in the practice, really taking that opportunity to visit and shadow seriously. I'd say a big red flag would be if, the practice doesn't want you to visit. I would say that's probably not a practice you should join. But you will see so many different patient and team interactions. You could also, I haven't done this, but I do have a colleague who did this once. You could be a patient there and see how they treat their patients as a patient. That's the best way to find out what it might be like to work there, is to have that patient point of view.
I like the undercover boss experience there.
Yeah. Here's another question. What do you think are the 3 important qualities of fresh dental graduates should develop before getting their first job in order to have a successful career? So 3 top qualities.
I would say one that I definitely look for is humble and hungry, and knowing that there's so much more to learn, and you're open to the creativity and the thinking outside the box, and open to learning and accepting mentorship. So it's one thing to ask for it, and the other is to actually truly accept it. And I find that the associates that come in that are super humble and hungry about achieving success in their career, they do very, very well.
Along that same lines, I would say honesty about your own level of ability at this time. Everybody's got a lot of room to grow. I don't care what you're doing when you first started in a practice, and being humble, like you said, and being receptive to mentorship and help is the best way to learn and get better.
One of the questions that I like to ask doctors that I'm getting to know is to really understand how they approach a difficult interaction with a patient or a parent or a team member. Because some of the things that I'm looking for as I'm asking that question is how the person I'm getting to know, how do they react in times of stress or in times of frustration? Because as a dentist, we're going to have all kinds of things come up that are frustrating, annoying, challenging, right? All kinds of things don't go well every day. And it's how we respond and react to those challenges that is going to make the day great, or lead to burnout and frustration. And so I think really working on yourself, right? Being open to reflection and growth is going to help you take on those challenges, whatever they may be, deal with those frustrations in a way where you continue to learn and grow, rather than burn out, stress out, hate your job.
And
And
probably
that's something
stress
that
out
can
your
only
team
come,
at the
from
same
within.
time.
Yeah.
Right. So here's a question. What's the best way to get in touch with dentists in a small town that I haven't lived in, but I'm moving because of a family situation? How do you get to know your dentist peers in a new place?
So get to know the other dentists in the community.
Mhm.
You can seek out some organizations that might be available, some local organizations. I know many cities, maybe a small city might not have one, but maybe the neighboring larger city will. And that's a great place to just meet a lot of colleagues. Sometimes there's groups as well on Facebook that you can scope out in that area just to see if you can get and connect with anybody. If it is, I believe the question is more so to meet your colleagues. If it's to find a dentist, I guess to speak with or interview with, a lot of the times you can just go around and go in straight into the practices if it's a really small town, and just say hi and kind of start there.
I'd go to the office and see if you can meet them. They may be busy, but if nothing else, stop at the front desk, introduce yourself, leave one of your cards. You'd like to meet the dentist there at some point in time if they're not available, but just go by, and very few people are going to say no, they don't want to meet you. So it's a good way to meet.
Especially if you leave cookies too.
Yes.
Well, and someone alluded to this.
Never come empty-handed. So
there's state dental associations, there's typically county dental associations,
right.
There might be study clubs in the area. And I think that as a a rule, they're very open to welcoming new dentists and making them feel like part of the community. So here's another question. What do private practices generally look for in an applicant when they hire, and what would make you stand out compared to someone else?
I go back to the communication skills. Can they relate to people when they go by and meet you to get an office, or if they're having an interview? Are you open? Are you communicative and receptive to things that go on in practice? I always look for someone who's receptive to change, because things change a lot when you get out of dental school. So you've got to be open to new things and be receptive to those. But communication skills are the most important.
I always want to know too that the doctor I'm considering working with or hiring, that they're going to work to put the patient first and to find ways to help that person with what that person needs help with primarily. And usually the patient does have a chief complaint or a chief concern. And if we can do our best to address that in some way in that initial visit, we're going to build, the first steps in a really strong and great relationship there. And you can do this without, giving someone 6 veneers when they need, 8 fillings and full mouth SRP, and right. You can have that conversation, talk to them about maybe some simple things you could do to help improve aesthetics as you're working through the fundamentals of a treatment plan. So I'm just picking on that as an example, right? But really connecting with patients to understand what they need and want before trying to help them understand what you see they need, right? You have to find that middle ground to really communicate effectively.
That's great. And don't try and oversell procedures, because it
No.
may not be what the patient needs.
Well, so you kind of
It's
have to meet them
it's
where they
very easy
are.
to tell when someone's trying to do that.
Mm-hmm.
And here's a question. Do you recommend making business cards when looking for a position, or is a resume sufficient?
I'm old school. A
Yeah.
card is always great to have. You can convert that into a contact in your phone if you want to. I think cards are just helpful.
Mhm.
Otherwise, you'll lose that communication piece. That's just me.
It doesn't hurt, and especially, right, depending on what type of events you're going to, handing out resumes, that's a big bulky piece of paper. A business card, you can personalize it, you can make it easy. You could even put a QR code on it to get your contact card easily.
Sure.
And yeah, so no, I think there's a lot of good things about a business card.
I've noticed in the past few events, I feel old now, but apparently digital business cards is very popular. So I went to a student event, and a lot of students actually had digital business cards already, and it was super easy to just share phone to phone, and it goes straight into your phone, which was very nice as well. But either way, having a concise card to get your contact is great.
Going back to the being well prepared for an interview, what attire would you recommend for interviews? Like a business suit? What should a new dentist be wearing to make their best impression?
I see the dental students come through on interviews at the dental school where I am in Dallas, and they're all dressed in a suit. Very few people wear suits these days for anything, but I was told a long time ago, you can never overdress for an occasion. You can underdress, but you can't ever overdress. So, if in doubt, dress up more than less.
I agree.
Impression.
Unless the practice specifically asks you to come in scrubs for an interview,
exactly.
I would wear.
They may do that.
I would wear a suit, or at least business casual, bare minimum.
Yeah.
Right. Something that looks professional and polished, right? Unless the practice says come in scrubs.
Mm-hmm.
Yeah.
This is back to more when you're in the practice and you're working as a new dentist. And it gets to communication with your dental team. But what are some of the managerial pitfalls a dentist can fall into when they're working with the team?
I'd say showing your frustration in a way that's unprofessional, right? Sharing feedback professionally is its own skill, as is receiving feedback, right? And this is a two-way street. And so I think having really strong communication with your team, where even if you're frustrated or upset, that you're going to be able to share it in a way that is received by your team. That's probably the biggest issue that I see. The other one would be allowing patients or the team to talk or gossip about other patients within the office.
Right.
That's another area where I've seen some challenges within teams, and it's our job to put a stop to that. We don't want to be talking negatively about anyone in the practice at any time.
And don't show favoritism for one employee.
Yes.
Yeah, treat them all equally, hopefully equally good, but don't sort one out for something more.
Mhm.
And a lot of our assistants, especially for not front teams, they really thrive on positive feedback. And if they're really excelling in something, is not acknowledging some of this hard work and great work that they do, because we could not do it without them. That really goes such a long way with them just feeling appreciated and seen.
And I agree.
Yeah.
Yeah. And it can be, oh, go ahead, Dr. Bell. I'm sorry.
No, if someone does something really good or special, write them a little note, like a little thank you note. No one ever recognizes anybody anymore in writing. So just write them doesn't have to be long, nice short note. Thank you for maybe you did something above and beyond, or brought something you anticipated that I needed that I didn't really think of. Thanks for doing that. It really made the day go better.
And I think of those types of gestures, right? When we take the time to build people up on those occasions, then when we need to have a serious conversation, we already have that strong relationship where those conversations are much easier to have. Whereas if you're only ever harping on the negative, right, people can stop listening, and the relationship suffers.
It's hard enough to find employees today. It's a very difficult market for employees, for offices to keep employees.
And I like what Dr. Patel said as well. We quite literally could not run a dental office without the team around us. It is
Exactly.
really hard to work solo. And so making sure you take the time to recognize that and celebrate that in your team will help bring everyone to the next level.
We are at about 10 minutes to the hour. Just have a couple more minutes before the ASDA folks close us out. Can I ask for any last words of wisdom? That's a hard one. I just threw it at all of you.
Well, I mentioned this before, be a leader in your practice. Make sure that the patients and all of your employees, they look to you as the leader. They look to you for guidance. Let them know that you appreciate them and you trust them, and strive for excellence in everything you do with you and your patients and your staff. I know it sounds kind of hokey, but it works.
I would say seek out a mentor as soon as you can. Finding a really good mentor, it really just, it will translate through your entire career, because they're really there for you for all of that time. So that was my biggest help in the beginning, is really finding a good mentor that helped me through every part of my career, whether it was managerial, patients, insurance, just a knowledgeable colleague.
In our company, we don't hire a new associate unless one of the doctors in the practice agrees to be the mentor, and they're compensated to do that too. Every one of us has had a mentor or two along the way, and we set it up with the young associate that they need to learn that mentorship spirit to do that when other people come along too.
We do the same as well. When we hire an associate, we do just try to set them up with an owner of the practice that's willing to mentor, especially if they're brand new. So just, I think Dr. Bell had mentioned really trying to find out what kind of time they do have for mentorship, and what that would look like, what that schedule would look like.
But I think I had two things, right? Everything you guys said is great. So I'm going to try to share some new pearls for the group. trying to get involved right away in a dental organization, whether it's your local ADA chapter, right? If you're going to continue on and be part of a DSO study club, that would be an opportunity. There's lots of different study clubs available, and that was meaningful for me as a new dentist because I got to meet lots of doctors in different stages of their careers, and I got to meet lots of specialists. And it's so powerful to be able to snap a photo of an x-ray and text someone to say, what do you think of this? And just get an honest answer, right? It's not, you're not going into depth. It just makes a huge difference to have a phone a friend relationship with a group of doctors that you can trust and depend upon. And that's not necessarily a formal mentorship relationship. So there's lots of ways to get mentorship without even labeling it as a formal mentorship program. So I just wanted to highlight that. The other piece is, as we were just chatting a little bit before this panel, that all three of us kind of said in a different way, like, I'm doing something a little bit different, or maybe something I didn't really think I would be doing or have the opportunity to do at this stage in our careers. And we're at different stages in our careers, obviously. So I would just keep an open mind. I have said yes to opportunities whenever they've come up, and I have yet to regret it. I've learned a lot of things and maybe had some experiences I didn't love. I'm still glad I said yes and kept giving myself that opportunity to learn and grow.
That's
Thank you.
exactly right. I never ever thought I would be doing something like this with a management organization like U.S. Oral Surgery Management. I had my path greased, and the skids were greased for retirement for me. And then this came along, and it's been great. Give me something to do. It's been wonderful. I've enjoyed every minute. And I'm older than the rest of you, and things change. You got to be willing to learn new things. In oral surgery, I did a lot of hospital surgery. The things that we did 10 years into practice didn't exist when I was a resident. So things always change, especially with the technology today. So
I have one. There are two questions. I'm not sure we're going to get to both of them. In big metropolitan states with lots of dental offices, how do you decide the right place to work, especially when you're moving there and have no idea about the dental culture in that new place? So what are the important things to consider when choosing the right place to work? I think y'all touched on it. If you have anything more to add, I think culture was probably the biggest one.
if your dental school has got an alumni group, if maybe there's anybody from your dental school that's in that, if it's in a big area, there's probably a chance, unless you're on the other side of the country, there's probably a chance that someone from your school is probably there, and that might be someone that you could meet, or go to the local dental society. They typically have monthly meetings, and you can meet people there and get an idea of the culture.
I love that. And here's the last question then. How many operatories should be in a clinic if there are 2 associates?
There's a lot of ways to answer that, right? How busy do you
Oral
both
surgery
want
is
to
going to be
be?
different.
I say at least 2.
I would say, yeah, at least 2. 2 per associate is always nice, maybe a floater room. So yeah, but that can vary so much with the schedules and the type of patient flow that the practices
That's
have.
right.
Well, thank you, everyone, and thank you for the students who posed questions. I hope that you got your answers, and I think these 3 dentists are pretty wonderful and have some good advice to share. And at this point, I think Linda's going to close us out.
I would agree with you. On behalf of ASDA, I would like to thank you for participating, students, in tonight's webinar, but I would also like to thank our great panelists, Doctors Bell, Patel, and Vaney, and also our wonderful moderator, Lisa Ward, and to the Association of Dental Support Organizations. For additional information about ADSO, you can see there's a QR code on the screen. Please utilize that. Lisa also mentioned earlier that they will have a session, an HR session about how to interview and work on your skills once you graduate at our National Leadership Conference coming up November 8th through the 10th. So if you are in Chicago and planning to attend, we strongly encourage you to join that session. If you'd like to view this webinar again, it will be posted within 1 week on ASDA's YouTube channel. It will also be saved in our webinar directory online. So to everyone, thank you all, and you have a wonderful evening.
Thank you all.
Thank you.
Thank
Thanks,
you.
everyone.